If your periods are very heavy, your uterus might be trying to tell you something. Hello everyone, I'm Dr. Dimple Doshi. Abnormal uterine bleeding is either of these: heavy bleeding with clots, bleeding lasting for more than a week, frequent bleeding, prolonged spotting, irregular bleeding like intermenstrual bleeding. Heavy regular menstrual bleeding is commonly seen when there are fibroids, adenomyosis, endometrial hyperplasia, or even cancer. If the bleeding is irregular, prolonged, or unpredictable, it may suggest hormonal imbalance as seen in young girls in perimenopause, obesity, and PCOD. If there is intermenstrual bleeding or bleeding between two periods, polyps, cervical tumors, endometrial hyperplasia are likely causes. If there is bleeding after sexual intercourse, it may suggest a disease in the cervix like cervicitis, erosion, cervical polyp, or something even more serious like cancer of the cervix. If your periods are very painful and very heavy, that pattern can suggest adenomyosis, sometimes with endometriosis. If bleeding happens after menopause, never ignore it. 90% of women with endometrial cancer have bleeding after menopause. However, postmenopausal bleeding can also be associated with benign conditions like endometrial hyperplasia or endometrial polyp. Your bleeding pattern gives clues, but your diagnosis needs a proper evaluation by your gynecologist.